In this video, we're going to go over the technique for sitting cervical manipulations. This video is only reviewing the technique and not regarding the safety and indications for the manipulations. If you have not had adequate training in doctorate of physical therapy school or adequate postgraduate training from physical therapy school, I recommend doing some serious reading on the different non-musculoskeletal differential diagnoses of neck pain and headaches. My go-to readings are the neck pain clinical practice guidelines. I think they do a nice job of highlighting the red flags regarding neck pain and headaches. The IFOMS guidelines, which are here, is also a good read regarding the safety of cervical manipulations and when they're indicated. Roger Carey has a good article out on the subject of recognizing vascular causes of neck pain and headaches. And then it's also good to be familiar with myelopathy research. So one of the good PT research articles I like is this one by Chad Cook. So you're going to have the patient in sitting. This should only be done by a licensed provider who has cervical manipulations in their practice act. So you're going to get nice and close to the patient and have them look up towards you. So if you want to go for C1, C2, this part of your fingers going to go over C1. You want nice soft hands, and the C1, C2 is mostly rotation, but so we're not manipulating all the way out here. We're going to add some side bending. So we're going to side bend her at C1, C2, and then look her up here. And then the C1, C2's purely a rotational thrust. So we're going to go down to the mid-cervical spine. So let's say I'm doing mid-cervical, I'll rotate, and then I'm going to side bend gradually to take up slack. You can also kind of shift the patient's weight over to take up more slack. With sitting, you get a little bit of compression too with gravity. And then so once you find a good spot, the thrust is rotational and slight slide bending. So this direction of force, this way. I like doing a bunch of mini thrusts to get the patient to relax. So rotation, side bending, a little bit of lateral glide. So I can feel she's guarded. So I'm just gonna ease into it with a bunch of mini thrusts. And then what I'm feeling for is her muscles to feel relaxed under my hand. And then once that happens, it's just a quick stretch, very small amplitude.